Hey, what's up, guys? This is Dr. Kotei, the primary care physician you can trust, breaking down the topics you care about in a way that you can understand. A lot of my patients have been asking me about black seed oil, wondering whether or not this is something they can take in order to help control their chronic medical conditions, whether it be blood pressure, diabetes, cholesterol, or even obesity. And I have to admit, I haven't even heard about black seed oil until just a few years ago. So I decided to, number one, buy a bottle for myself and try it out. And number two, also go through the medical literature to see what we actually already know about this mystery oil. You want to know what I find out, don't you? Of course you do. That's why you clicked on this video, so stay tuned. I've been taking black seed oil over the past few days, and my initial impression is that I actually do feel better overall. This morning when I woke up, I didn't feel as tired or groggy, and yesterday I did some yard work and I didn't feel all achy afterwards. I guess we'll see whether or not it actually lowers my LDL cholesterol, which was slightly elevated a few months ago when I had it checked at the doctor's office. If you want to know which black seed oil product that I'm using, then click the link below to check that out. I've also dropped some links below to other highly rated black seed oil products sold on Amazon. So let's talk about what black seed oil actually is. It comes from a plant called Nigella sativa, which is a plant native to Southwest Asia. When the seeds from this plant, called black cumin seeds, are pressed, the oil is extracted, and that's what black seed oil is. The most active ingredient in this extract is a chemical known as thymoquinone. This has been used for thousands of years by many different civilizations, including ancient Egypt, as a condiment and to cure various ailments. I was surprised to see that there's actually a lot of literature out there on black seed oil. There have been quite a few experiments performed in the laboratory to see what effect it has on different chemical processes. And also there's been quite a few randomized control trials studying the effects of black seed oil on various medical conditions as well. What I'm going to do is I'm going to go through each medical condition one by one, starting with blood pressure or hypertension. There have been multiple randomized control trials studying the effects of black seed oil on lowering of blood pressure. They've been compared to placebo, or basically just a fake pill or fake treatment. There have also been comparisons to standard therapy as well. And some of these trials have shown that black seed oil can have a significant reduction in blood pressure, both systolic and diastolic, especially when compared to placebo. In the case of diabetes, black seed oil has been shown to both lower fasting glucose levels or fasting blood sugar levels, and also lower the A1C, which is a number that we check every few months to see what the status of someone's diabetes is. And it's been shown to do this in various randomized control trials performed on humans. The effects of black seed oil on cholesterol levels has also been studied. It's been shown to decrease your LDL levels, which is the bad cholesterol that puts people at risk for heart disease and stroke if it's too high. It's been shown to decrease total cholesterol levels, triglyceride levels, and also in some cases it's been shown to increase your HDL cholesterol. The HDL is the good one that actually protects you against heart disease. And this has all been shown in randomized control trials. Black seed oil might also help with obesity as well, because it's been shown to lower body weight, decrease body mass index or BMI, and also lower waist circumference in some cases. So, hypertension, diabetes, high cholesterol, obesity, these are all the chronic medical conditions that I deal with on a daily basis with my patients, and it seems that black seed oil could potentially help with all of them. But as I read on while doing my research, I discovered that it can potentially help with a lot of other medical conditions as well. Like, for example, in asthma, there was a randomized control trial involving about 60 patients that showed that black seed oil had the potential to improve lung function and also decrease the inflammation involved with asthma. In the brain, it's been shown to increase higher level thinking or cognition. It can work as a mood stabilizer and potentially decrease anxiety as well. When you look at the literature, you also see some studies or some experiments on black seed oil's effects on cancer. Now, none of these studies have been randomized control trials performed on humans. It's only been the laboratory experiments performed in the test tube on isolated cells. But in these experiments, it has been shown to slow down the growth of tumors and the replication or the making of more cancer cells. But with that information, I don't want anybody who's actually on cancer treatment in real life to stop their cancer treatment in order to take black seed oil hoping that it's going to take away your cancer, because that has not been proven to be the case. In small trials, black seed oil has been shown to decrease pain or the inflammation surrounding certain painful conditions. And overall, it seems that it can decrease inflammation in general. So, you still want to know at the end of the day, is black seed oil safe and effective? And can I take it in order to treat my chronic medical conditions? The short answer to that question is for the most part, yes, but there are a few caveats. I know I hear you thinking to yourself, here we go again with this Western doctor trying to talk me out of taking these natural things in order to treat my medical conditions. But hear me out. First of all, even though it was pretty much well tolerated in a lot of the randomized control trials that I took a look at, there have been some side effects and adverse reactions that have been reported when using black seed oil. The main ones are upset stomach, nausea, constipation. In some cases, some people can be allergic to it, and especially when you apply it onto the skin, it can cause dermatitis, which is basically an inflammatory reaction or allergic reaction on the surface of your skin when it comes in contact with black seed oil. So you have to be careful about that. Also, another very important thing to know about black seed oil is that it's an anticoagulant, meaning that it can actually make your blood thinner. So in some cases, some people are already on blood thinners for certain medical conditions. And if that's the case, then it wouldn't be a good idea to take black seed oil, because then it can actually make your blood way too thin and put you at risk for a bleed, which can be very serious and in some cases potentially life-threatening. Likewise, if you've already had some kind of a bleeding event in the past, whether it be blood in your stool, blood in your urine, a bleed in the brain, then in these cases you definitely don't want to try black seed oil, because it's a chance that it can make you have another episode like that. Another thing to keep in mind about black seed oil's effect is that because it has the potential to maybe lower the blood pressure a little bit, if you're already taking blood pressure medications and taking black seed oil at the same time, then it does have the potential to maybe make your blood pressure a little bit too low. So that's why it's important to make sure you're always checking your blood pressure and following up with your primary care doctor in order to make sure that your blood pressure is at a safe level while taking black seed oil. And for that reason, it might be a good idea to really only reserve it for people who, might be on blood pressure medications, but are not quite doing the job and your blood pressure is still a little bit elevated, or also people that are kind of on a borderline and not on blood pressure medications yet. Maybe it can actually be the one thing to kind of help them, keep them at a level that will enable them to avoid medications. But of course, all this is something that you have to discuss with your primary care doctor, and you should never make these decisions on your own without consulting one first. Another thing that I wanted to point out is that a lot of the studies I was able to find were actually performed in either Middle Eastern or Asian countries. And as you might know, for the most part, my audience is comprised of a group of people that belong to a different demographic or a different ethnic group. So those studies performed over there might not necessarily apply to someone else that might be watching this video if you don't belong to those same ethnic groups. We definitely need more studies performed, preferably in the United States, to actually see what the effects are and see whether or not those findings are generalizable to other people. The one thing that I really want to stress to you is that you should not use black seed oil to replace any medications that were prescribed to you by your medical doctor. If anything, it should be used alongside those medications, and you should always have a discussion with your doctor to see whether or not this is the right idea for you personally. There doesn't appear to be any general consensus about the perfect dose to take of black seed oil, so what I would recommend is to just take the amount directed on the label of whatever product that you actually purchase. I would also recommend that you would get one that's USDA or US Department of Agriculture certified organic. And the reason for that is because since these products are not official medications, they're not actually approved by or inspected by the Food and Drug Administration, the FDA. But if it's USDA certified, that means some kind of governing body at least inspected it to make sure that it meets some kind of standard. And you want that whenever you're dealing with any kind of product that you're going to put in your body. Some studies say that the oil is more effective, others say that the powder is more effective, and then some studies show that the capsule can be effective as well. So in terms of which form of black seed oil to get, that kind of really all depends on preference. One thing I will mention is that the liquid does not taste very good, so it can be hard to keep down for some people. So if that's the case, you might want to try the capsule instead. So that's pretty much what I got to say about black seed oil. It looks like for the most part, so far so good for me. In the trials that I looked at, it does have the potential to be effective, and for the most part it does appear to be safe. But of course, if you're going to try to take it and you have multiple chronic medical conditions, make sure you discuss it with your primary care doctor first, just to make sure that it's something that's right for you. I'm going to be trying it over the next few months and taking it and seeing exactly what effects it has on my body. If you do want an update video, make sure you drop a line below to let me know that you're interested in the update video, and I will make that on request. If you want to know exactly which product that I'm taking, make sure you check out the link below for that, and also check out the other links to the other products that are highly rated by Amazon. If you have not subscribed to Trust PCP, make sure you do so as well. Thank you for watching. Peace out.